my name is Maneet and I am a third-year medical student at St. George's University School of Medicine. I thought I would make a video just going over how the rotation is structured, what a day-to-day schedule looks like, and how I studied and was evaluated for surgery. So like always, if you have any questions or anything that you'd like to talk about, my DMs are always open and I am always more than happy to help. So with that being said, let's get started. So how is surgery structured? So surgery is 12 weeks long and it was divided into 3 different sections. So my first section was 6 weeks long. I was with a general and bariatric surgeon and his schedule was Tuesday to Saturday. Then for my next 3 weeks, I was on orthopedic surgery and my schedule was Monday to Friday. And then my last 3 weeks, I was on vascular surgery and my schedule was again Monday to Friday. So in terms of what a typical day looked like for me, this was very dependent on if it was an OR day or if it was a clinic day. So on OR days, it was an earlier start. We'd start around 7, 8 a.m. just depending on when the first case was scheduled. And we would go until anywhere from like noon or the evening based on how many cases were scheduled for the day. And this just varied on the day, depending on how busy it was. So let's say we started at 7 a.m. We'd pre-chart. I would go see the patients with the doctor. And once the doctor had seen the patient, had cleared the patient, we'd scrub in, we'd change into surgical scrubs to go see and start the surgery. So during the surgery, there would always at least be one student assisting the surgeon. So if you weren't assisting, you were shadowing from the side and you were in the OR. So assisting with incisions, you'd help the surgeon suture, you'd help the surgeon hold different retractors, different tools. It was just kind of assisting the surgeon and just being helpful in any way that was needed. If it wasn't a surgery day and it was a clinic day, clinic days typically started around 9 a.m. and ended around 4 or 5 p.m. So usually clinic days were busy. It was a lot of appointments, and usually for like bariatrics, we did a lot of the times we were doing the HPIs and the physical exams before the doctor came. For orthopedics, it was a lot of shadowing and a lot of helping with the shots. And in vascular, it was a lot of shadowing and just seeing a lot of pre-op, post-op patients. Of how I studied and what resources I used. So SGU will assign you weekly AMBOSS quizzes, so I would do these on the weekend and review them on the weekends. In terms of UWorld, before the rotation started, I would allocate a number of questions every single day. For me, I knew that my surgery rotation would be very rigorous, but I knew that the first 6 weeks were a little bit lighter. So I aimed to be done UWorld by the 6-week mark. So then I would have the last 6 weeks to do incorrects and finalize like content review. So how I did UWorld. So I found that UWorld is my main way of studying. So I tried to be as thorough as possible. So when I did a question, I would always have a Google Doc open in which I would use to make my own notes. So let's say I had a question on hernias. Then on Google Doc, I would have hernias in like one font. And I would have my subheadings in one font because I'm a very visual learner and I need stuff to be like color coded and like organized in order for my brain to remember things. So then after the subheading, I would color code everything. So like I had a different color for like risk factors. I had a different color of diagnostic criteria. I had another color for like treatment, or another color for like complications of surgery. So things like that, just so that my brain could kind of organize everything and learn. And this helped me learn. So this was my first pass. Then my second and third pass would be reviewing this Google Doc and doing the incorrects. And I did this until I had no more incorrects left. My fourth pass of content was with Melman. So on Google, if you Google Melman PDF surgery bullet points, you'll get a document. And this breaks down the very high yield topics and just how NBME will ask you questions. So for the Melman document, I would do this at the very end when there was like a few days before the exam. So now I've covered AMBOSS, UWorld, and Melman. For Anki, I did 50 cards every single day, and by the last bit, I had just my reviews left. So my last little bit was just going over my reviews and really solidifying my knowledge. And for the Anki deck, I use Zonky and an M3 deck. And then for NBME exams, I would leave this towards the end once I felt like I had a good foundation for all the knowledge. So once I was done my like bulk of my content, like almost maybe I'm on my 3rd pass of UWorld, then I would start NBMEs. And I was very thorough with reviewing them. I kind of did my notes for like NBME review very similar to how I did them for UWorld, as I just felt like this was what worked the best for me. And I made sure I knew the NBME topics inside and out in different ways of how they were asking them, because I found that it would show up on the shelf exam. So at the end, when I was done all my content review, I watched the Dr. High Yield Surgery video just as another form of content review to make sure that if there was anything that I missed, or just to get a refresh of all the high yield points. So that is how I studied. So now moving on to evaluation. 2 main exams. There's a mid-core and the shelf exam. So the mid-core happens at home on Exemplify on your laptop. It's going to be on the 6th Monday of the rotation, and it's 2 hours and 45 minutes long and 110 questions. For your midterm exam, I would recommend following AMBOSS. So any content that is covered in AMBOSS before your mid-core date, I would make sure to know that, because that content and those topics are what what SGU is going to pull from to make your mid-core exams. You can use UWorld if you like, but make sure you're covering the same concepts that are covered in AMBOSS leading up to your mid-core exam. And moving on to your shelf exam. Your shelf exam makes up the bulk of your overall grade. It happens at a Prometric center towards the end of the rotation. SGU will email you a permit which allows you to schedule your exam. It's 2 hours, 45 minutes, and 110 questions. You'll also have 5 case write-ups. Make sure to look in your syllabus because they're always changing. There's 5 SOAPs that you have to write throughout the duration of your surgery. There's also patient encounter logs, which are posted on Sakai, so make sure you look at exactly what's required so you meet this requirement and don't lose any point. There's a few modules that you need to complete and a few feedback forms. So I would just refer to Sakai and your syllabus to make sure you meet all the requirements and don't forget it. With that being said, that's all that I have for the surgery rotation. I hope this video was helpful and provided some guidance and some information. And like always, if you have any questions or if anything was unclear, feel free to reach out. I'm always more than happy to help. I know surgery is one of the more rigorous rotations due to its crazy schedule and long hours, but know that you're so capable, you got this, and you're going to make a great physician.